Hello, everyone. Thank you for having me. I'm glad to be given the opportunity to talk about the global pandemic. COVID 19, the highly contagious viral illness caused by SARS coronavirus 2, has had a catastrophic effect on the world's demographics, resulting in more than 3.8 million deaths worldwide, emerging as the most consequential global health crisis, compelling the WHO to declare it as a global pandemic. Even though substantial progress in clinical research has led to a better understanding of coronavirus and the management of COVID 19, limiting the continuing spread of this virus and its variants has become an issue of increasing concern, with many countries enduring a second or third wave of outbreaks. Based on the recent epidemiological update by the WHO, four variants of concern, which is Alpha, Beta, Gamma, and Delta, have been identified since the beginning of the pandemic. The primary mode of transmission is exposure to respiratory droplets carrying the infectious virus from close contact, or droplet transmission from pre-symptomatic, asymptomatic, or symptomatic individuals harboring the virus. The other possible modes of transmission include airborne, fomite, fecal-oral, bloodborne, mother-to-child, and animal-to-human transmission. Individuals of all ages are at risk of contracting this infection and severe disease. However, people aged above 60 years and people having underlying medical comorbidities like obesity, cardiovascular disease, chronic kidney disease, diabetes, chronic lung disease, and cancer have an increased risk of developing severe COVID 19 infection. Although the respiratory system is the principal target of the virus, it can also affect the major organ systems such as the gastrointestinal, hepatobiliary, cardiovascular, renal, and central nervous systems. The median incubation period is estimated to be 5.1 days, and the majority will develop symptoms within 11.5 days of infection. The clinical spectrum of COVID 19 varies from asymptomatic or paucisymptomatic forms to clinical illness characterized by pneumonia, acute respiratory failure, multiple organ failure, septic shock, and death. Majority of symptomatic patients are commonly presented with fever, cough, shortness of breath, trouble breathing, fatigue, chills, body aches, headache, sore throat, congestion of runny nose, loss of smell and taste, nausea, or diarrhea. COVID 19 complications may be caused by a condition known as the cytokine release syndrome or the cytokine storm. This is when an infection triggers your immune system to flood your bloodstream with inflammatory proteins called cytokines. It can kill tissue and damage your organs. Besides symptomatic patients, patients with atypical symptoms, or anyone with known high risk exposure to the virus should be tested even in the absence of symptoms. Currently, a variety of therapeutic options are available that include antiviral drugs, anti-SARS coronavirus 2 monoclonal antibodies, anti-inflammatory drugs, and immunomodulator agents. Safe and effective vaccines are a game changing tool, but for the foreseeable future, we must continue wearing masks, cleaning our hands, ensuring good ventilation indoors, physically distancing. The Serum Institute of India AstraZeneca Covishield vaccine, the Bharat Biotech India Covaxin, and the Gamaleya National Center Sputnik 5 vaccine are the vaccines available in India. The vaccines of major pharma companies like the Pfizer, the Johnson & Johnson, and the Moderna are not available in India now. Until most of the world's population get vaccinated, COVID-19 will continue to remain a threat to global public health. Prevention and management of COVID-19 requires a holistic and interprofessional approach. We must ensure fair and equitable access to vaccines and guarantee every country receives them and can roll them out to protect their people. Thank you.